My name was Dr. Michael Harrison, and if you're hearing this story, it's because my revenge has finally come to pass. I died at 52 years old on a cold December night in 2023 at my home in Riverside, Oregon. But before I explain how I planned my posthumous revenge, you need to understand who I was and what brought me to that fateful moment. I was born in 1971 into a middle-class family in Portland. My father, Robert Harrison, was a mechanic, and my mother, Linda, worked as a secretary at an elementary school. They always taught me that a person's worth wasn't measured by what they owned, but by the good they did for others. That lesson shaped my entire professional life. At 18, I earned a scholarship to the University of Oregon, where I graduated with honors in medicine. During college, I worked part-time in a nursing home to help cover my expenses. It was there I came face to face with the harsh reality of underprivileged patients, elderly people abandoned by their families, those with no financial resources who relied solely on the kindness of others to survive. I promised myself that once I became a doctor, I would never turn anyone away because they couldn't afford treatment. In 1998, at age 27, I began working as a general practitioner at Riverside General Hospital. The small town of Riverside, with its 15,000 residents, was the perfect place to practice the compassionate medicine I had always dreamed of. The public hospital mostly served low-income families, farm workers, and elderly patients with limited Medicare coverage. In the early years, I earned a reputation as the doctor who never said no. I treated patients during off hours, made house calls on weekends, and often paid for their medications out of my own pocket. In 2003, I opened my own private clinic, but I enforced a strict policy. 40% of my appointments were reserved for low-income patients at no cost. That same year, in 2003, I met Sarah, a pediatric nurse who had just moved to Riverside after finishing her residency in Portland. Sarah shared my vision of social medicine. We got married in 2004, and although we never had children of our own, we found purpose in caring for the children of our community as if they were ours. Over my 25-year career, I built a strong reputation. The people of Riverside knew me as Dr. Mike, the doctor who was always available, who understood that sometimes a hug could heal more than any prescription. My colleagues at the hospital initially respected my dedication, even if they didn't fully understand it. Everything began to change around 2020. The hospital underwent administrative restructuring, and 3 new doctors were hired. Dr. Richard Stevens, a cardiovascular surgeon from Seattle, Dr. Elena Martinez, a cardiologist educated at a prestigious private university, and Dr. James Walsh, an anesthesiologist with a background in private hospitals in Portland. At first, I was excited about their arrival. Riverside was finally getting top-tier specialists, which meant better care for our community. Dr. Stevens, in particular, seemed impressive. 45 years old, impeccable resume, and promises to revolutionize the hospital's cardiac department. But something felt off from the beginning. In medical meetings, they constantly brought up revenue optimization and talked about maximizing the financial potential of each patient. When I questioned whether that might compromise the quality of care, Dr. Stevens smiled condescendingly. "Michael, you need to understand that medicine is also a business. We can't help anyone if the hospital goes bankrupt." The first red flags appeared in early 2023. I noticed that elderly patients coming in for routine checkups were suddenly being scheduled for increasingly complex procedures. Mrs. Dorothy Peterson, 78 years old, had lived for decades with a mild arrhythmia managed by medication. Out of nowhere, Dr. Stevens recommended a pacemaker, claiming her condition had deteriorated dangerously.
When I reviewed Mrs. Peterson's records, her test results showed the same stable condition as always. I confronted Dr. Stevens about it, and he assured me there were subtle indicators on the EKG that I, as a general practitioner, might not recognize. I accepted the explanation, but a seed of doubt had been planted. My suspicions grew as I began to notice the spending habits of my colleagues. Dr. Martinez swapped her Honda Civic for a BMW X5. Dr. Walsh showed up with a $15,000 Rolex Submariner. Dr. Stevens bought an $800,000 home in a wealthy Portland neighborhood, while keeping just a small apartment in Riverside for on-call shifts. "We've been doing well with some investments," was the explanation I got when I asked about their sudden prosperity. But public hospital doctors in a small Oregon town don't make the kind of money that supports that lifestyle. The turning point came in September 2023, during a night shift. I was passing by room 237 when I overheard quiet voices. It was Dr. Walsh talking to Dr. Martinez about Mr. George Hamilton, an 84-year-old man admitted for a simple cataract surgery. "His insurance covers up to $50 grand, he whispered. "If we stretch the stay by a week and throw in a few cardiac tests, we can max it out." "What if the family asks questions?" Dr. Martinez replied. "Old folks are fragile. We can always talk about unforeseen complications." My stomach churned. I couldn't believe what I was hearing. These were fellow doctors, casually discussing how to financially exploit a vulnerable patient. That night, I decided to investigate further, and what I uncovered in the weeks that followed would forever change the way I viewed the men I once considered partners in the mission to save lives. Before we continue, let me know in the comments, where are you watching from? I'd love to see how far our stories are reaching around the world. What I discovered in the following weeks chilled me to the bone. In 25 years of practicing medicine, I never imagined I would witness such a grotesque perversion of the Hippocratic Oath. But Stevens, Martinez, and Walsh had turned Riverside General Hospital into a human meat grinder disguised as a healthcare institution. I began my investigation cautiously. As the hospital's most senior doctor, I had access to historical patient records and mortality statistics. What I found was alarming. Since the trio's arrival in 2020, the mortality rate among elderly patients had increased by 40%. Even more disturbing was the fact that the hospital's revenue had skyrocketed by 300% during the same period. I decided to dig into individual cases. Mrs. Ethel Brooks, 82, had died 3 weeks after an emergency heart surgery performed by Dr. Stevens. Upon reviewing her pre-op exams, I found she only had a mild aortic stenosis, fully manageable with medication. There was absolutely no medical justification for the invasive surgery that ultimately took her life. Mr. Robert Chen, 75, died of post-operative complications after a gallbladder surgery that inexplicably lasted 6 hours. The standard procedure takes no more than 2. When I examined their surgical records, I found notes about additional findings requiring intervention, but no specifics on what those were. The pattern became clear after analyzing dozens of similar cases. They were targeting elderly patients with good insurance plans, fabricating medical emergencies to justify expensive procedures, prolonging hospital stays with unexpected complications, and more often than not, the patients didn't survive the unnecessary trauma. But the scheme was even more sinister than I had feared. One night in October, I stayed at the hospital after my shift to observe their late-night habits. Around 2 a.m., I saw Dr. Walsh enter the room of Mrs. Agnes Murphy, an 89-year-old woman in terminal palliative care. She had been in that state for 2 weeks, with her family expecting her natural death at any moment. I hid behind a partially open door and watched Walsh adjust the morphine pump. What I saw shocked me. He drastically increased the dosage, far beyond what was needed for comfort. Mrs. Murphy died 15 minutes later. "Another bed freed up," I heard Walsh mutter to the night nurse, who didn't even flinch at the comment. Digging deeper, I discovered that the hospital received performance bonuses based on bed turnover rates. The faster a terminal patient died, the sooner the bed could be reassigned to a more profitable case. They were literally killing dying patients to speed up the flow of income. The most devastating revelation came when I gained access to the doctor's computer files. Stevens had forgotten to log out of a shared terminal, and I seized the chance to explore his folders. What I found was a fully developed business plan. In a folder titled Riverside Project, there were spreadsheets showing the revenue per patient for each type of procedure. They had calculated exactly how much profit each surgery generated and created monthly quotas. Stevens was required to perform at least 8 cardiac surgeries per month, Martinez had to diagnose 12 cardiac emergencies, and Walsh was expected to expedite the death of at least 6 terminal patients. Even more shocking was an email exchange between the three dated August 2023. Stevens: "We need to be more selective. Michael is asking questions about Mrs. Peterson." Martinez: "He's always been an idealist. Thinks medicine is a charity." Walsh: "As long as he keeps working for free, we're fine. But if he starts digging, we'll have a problem." Stevens: "Let's keep a low profile for now. And Elena, that patient of yours in room 15 needs to go soon. The family is asking too many questions about the billing." Martinez: "I've already spoken to James. She'll have a respiratory complication tonight." I felt a rage I never knew before. These monsters were playing with human lives like they were numbers in a spreadsheet. Families were losing loved ones not to illness, but to pure, unfiltered greed. I continued gathering evidence. I photographed falsified medical records with my phone, always when I was alone in the archive room. I recorded conversations where they openly discussed their crimes, using a small digital recorder I kept hidden in my coat pocket. I discovered they had offshore bank accounts in the Cayman Islands where they stashed the profits from the scheme. The final blow came when I gained access to the hospital's financial records. They had created a shell company called Riverside Medical Consulting, which received consulting payments from the hospital for services that never existed. That's how they laundered the money from their fraud. By November, my investigation was complete. I had enough evidence to destroy the trio and potentially reform the entire healthcare system in Oregon. But I knew I was in danger. In one of the recordings, I heard Stevens say, "If anyone finds out, we're looking at life sentences. We can't let that happen." I decided to act fast. I scheduled a meeting with federal agent Tom Richardson for the morning of December 15, 2023. Richardson was known for his integrity and had prosecuted several medical fraud cases in the past. I prepared a full dossier with everything: photographs, recordings, financial documents, and statistical analyses of the suspicious deaths. But I underestimated my colleague's paranoia. On the night of December 14th, the hospital held its annual holiday dinner at the Riverside Country Club. It was a tradition I had attended for over 20 years, a usually joyful evening to celebrate another year of saving lives. This time, the atmosphere was different. Stevens, Martinez, and Walsh seemed unusually cheerful, almost euphoric. During the dinner, I noticed them whispering to each other and watching me closely. "Michael, you seem tense," Martinez said. "Everything all right?" "Just tired," I replied, trying to remain casual. "It's been a rough year." "We know how devoted you are to your patients," Stevens said, with a smile that didn't reach his eyes. "Your passion for medicine is truly admirable." Around 10 p.m., Stevens approached with 2 glasses of whiskey. "Michael, I'd like to make a special toast. To your 25 years of tireless service to this hospital, you're an inspiration to us all." The whiskey had a slightly bitter taste, which I attributed to the brand. Stevens insisted I finish it. "You can't toast halfway, Michael. That brings bad luck." I drank it out of politeness, but I began to feel unwell within minutes. My heart was racing, my hands trembling, and a burning sensation spread through my chest. "I think I need to head home," I said, trying to conceal my discomfort. "Of course, Michael," Walsh replied, with feigned concern. "You look pale. Want someone to go with you?" "No, thank you. Sarah is waiting for me." The drive home was a nightmare. My vision blurred, my heart pounded irregularly, and I could barely keep my hands on the wheel. I arrived at 10:45 p.m., struggling just to climb the steps to the porch. "Michael, you look awful," Sarah exclaimed when she saw me. "What happened?" "Probably just some indigestion," I lied, not wanting to alarm her before handing the evidence to the FBI in the morning. "I'm going to lie down for a bit." At 11:15 p.m., while Sarah was making tea in the kitchen, I felt a searing pain in my chest. It was as if someone was squeezing my heart in a vice. I tried to call out for help, but no words came out. I collapsed on the living room floor, convulsing. Sarah rushed to help me, screaming my name. But I already knew it was too late. In my final moments of consciousness, one word echoed in my mind: digitalis, the very substance they had used to murder elderly patients. I died at 52 at 11:32 p.m. on December 14th, 2023, officially listed as the victim of a sudden cardiac arrest due to pre-existing heart conditions, which I never had. The autopsy was conducted by none other than Dr. Walsh, who signed the death certificate without hesitation.
But I had prepared for my own death. In the final weeks of my life, when I realized I was being watched and my colleagues were beginning to suspect my investigation, I took precautions to ensure my revenge would unfold even after I was murdered. The first measure was creating a life insurance policy for my evidence. Rebecca Santos, my trusted nurse of 15 years, received a key to the safe at my private clinic, along with a sealed letter and very specific instructions. "Rebecca, if anything happens to me, especially if my death is sudden or suspicious, open this safe exactly 6 months after my funeral and hand everything inside to the FBI. Do not open it before that date, no matter what Sarah or anyone else tells you." Rebecca found it strange, but she knew my meticulous nature. Dr. Harrison was always careful about everything, she thought. This must just be one of his many precautions. The second precaution was even more ingenious. Suspecting they might try to poison me, I began secretly collecting samples of my own blood twice a week and storing them in small vials in the clinic's freezer. I labeled them research samples and locked them in the same safe. If I was killed by poison, post-mortem analysis could compare my normal blood with the sample from the date of death. I also installed hidden audio recorders in 3 strategic locations: my desk at the hospital, the doctor's locker room, and the conference room. These devices had 60-day continuous recording capacity and were set to activate automatically starting December 2023. The third and most devastating measure was a secret deal with a private investigator in Portland, Marcus Webb. 2 weeks before my death, I hired Webb with clear instructions. If I die suddenly, I want you to investigate my personal finances versus those of the 3 doctors I suspect. Prove they're making money illegally. The day after my death, while my family grieved and my murderers played the part of devastated colleagues, the first stage of my revenge began, quietly. Stevens, Martinez, and Walsh, convinced they were in the clear, ramped up their criminal activities. Believing the Michael problem had been solved, they acted even more recklessly. In January 2024, just 1 month after my death, they increased the number of unnecessary surgeries and sped up the deaths of terminal patients. Now we can work without that moralist watching us, Stevens said in a conversation captured by the hidden recorder in the conference room. Michael was always an obstacle to progress, Martinez agreed. At least now we have full control. Meanwhile, they began pressuring Sarah to sell my private clinic. It'll be hard for you to manage it alone, Stevens told her during a condolence visit. We have a buyer who's offering $200,000. It's a fair price for a small clinic. The clinic was worth at least $800,000. They were trying to buy it for a fraction of the value, likely to turn it into yet another hub for their illegal profits. Sarah, still deep in brief and unfamiliar with medical business dealings, actually considered the offer. Michael always said you were good friends, she told Stevens. If you think selling is the right move. Definitely, Stevens replied with false compassion. Michael would want you to move on.
March, April, May went by. My killers thrived, my widow nearly got swindled, and dozens more innocent patients fell victim to their scheme. But in June 2024, exactly 6 months after my death, Rebecca Santos opened the safe. What she found left her in total shock. Inside were 3 large folders, organized with the meticulous care that defined me. Folder 1, Evidence of the Scheme. Over 300 photographs of falsified medical records, 47 incriminating audio recordings, copies of offshore banking documents, and detailed statistical analyses of suspicious deaths. Folder 2, Evidence of my murder. Included were the preserved blood samples collected before my death, an audio clip where Stevens said, "If Michael hands over this evidence, we're all going to prison. We need to take care of this before tomorrow," and a letter detailing my suspicions about being poisoned. Folder 3, Instructions for Vengeance, contained the contact information for the FBI, investigator Marcus Webb, and precise steps to deliver the evidence for maximum legal impact. Rebecca immediately called the number I had left for her, Special Agent Jennifer Clark with the FBI in Portland. Agent Clark, my name is Rebecca Santos. I have evidence of murder and medical fraud that Dr. Michael Harrison left behind to be delivered after his death. The federal investigation began the very next morning. When the evidence was reviewed, the results exceeded even my most optimistic expectations. Analysis of my preserved blood revealed a lethal dose of digitalis, the exact same substance found in the blood of 23 elderly patients who had died naturally at the hospital. The hidden audio recorders had captured 6 months of incriminating conversations, including detailed plans for future murders. The final blow came when Marcus Webb delivered his financial report. He discovered that the trio had funneled more than $3.2 million into offshore accounts over the previous 3 years, a sum impossible to explain with public hospital salaries. On June 20th, 2024, during what should have been just another day of criminal routine, Stevens, Martinez, and Walsh were arrested simultaneously by federal agents. Stevens was taken in the middle of performing an unnecessary surgery.
Martinez was pulled from a consultation where she was ordering expensive, unnecessary tests for a healthy patient. Walsh was handcuffed while increasing a morphine dose for a terminal patient. The look of absolute shock on their faces when they realized I had defeated them even from beyond the grave was, according to agents present, unforgettable.
The trial of the three doctors became the biggest medical scandal in Oregon's history. The evidence I had gathered was so complete and irrefutable that even the best defense attorneys couldn't build a plausible case. Dr. Richard Stevens was sentenced to life in prison without the possibility of parole for 31 counts of first-degree murder, including mine. Dr. Elena Martinez received 45 years for complicity in homicide and insurance fraud. Dr. James Walsh, considered the direct executor of the overdose murders, was also sentenced to life in prison. During the trial, even more shocking details emerged. The investigation revealed that they had run similar schemes in 2 other hospitals in Oregon before coming to Riverside. The total number of victims may have exceeded 100 over the course of 5 years. Families of the victims received multi-million-dollar settlements from insurance companies and the hospital itself, which was found negligent for failing to detect the scheme. Many of these families, who had accepted the deaths as God's will, finally learned that their loved ones were murdered for profit. Mrs. Dorothy Peterson, the case that first raised my suspicions, survived because her pacemaker surgery was canceled after the arrests. At 79, she still lives independently, her arrhythmia controlled with the same simple medications that had always worked. Sarah, initially devastated upon learning I had been murdered, found renewed purpose in my revenge. Using the $2.8 million settlement from the lawsuit against the hospital, she transformed my private clinic into the Michael Harrison Memorial Medical Center, a completely free medical facility for low-income families. Michael always said medicine is a calling, not a business, Sarah declared during the center's inauguration in December 2024. This place will ensure that his mission lives on. Rebecca Santos was promoted to head of nursing at the Memorial Center and became a national advocate for medical ethics. She often shares my story in lectures to medical students. Dr. Harrison taught me that doing the right thing sometimes means being ready to pay the ultimate price. Riverside General Hospital underwent a complete administrative and protocol overhaul. New systems for surveillance and auditing were implemented to prevent future fraud. The hospital is now considered a national model for transparency and medical ethics. Marcus Webb, the private investigator I hired, used the case to found a company specialized in detecting medical fraud. Michael Harrison showed me that not even death can stop justice, says Webb. He planned the perfect revenge. The most satisfying part is knowing that my death saved hundreds of future lives. The reforms enacted after the scandal have prevented other corrupt doctors from exploiting vulnerable patients. Medical organizations across the country adopted protocols inspired by the Harrison case to prevent similar frauds. FBI agent Jennifer Clark, who led the federal investigation, summed up the impact of my revenge perfectly. Dr. Harrison didn't just bring justice to his own victims, he created a legacy that will protect patients for generations. He proved that medical integrity is worth more than life itself. My posthumous revenge was complete. The murderers are rotting in prison. The victims received justice. My wife found a new purpose, and the system that enabled these crimes was entirely reformed. As I wrote in my final letter to Sarah, if my death can save more lives than my life ever could, then every second of planning was worth it. Justice sometimes comes from the most unexpected place, even from beyond the grave.